Hello, I'm Cindy Arenberg Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. Today we'll be talking about the Children's Health Insurance Program, also known as CHIP, which benefits about 9 million children and their families throughout the U.S., including more than 340,000 children in Florida alone. CHIP was created with bipartisan support back in 1997. It is a joint state-federal partnership that makes low-cost health insurance available to children who don't qualify for Medicaid, but whose families cannot otherwise afford health insurance. It requires funding reauthorization from the federal government every few years. The last reauthorization expired in September of 2017, which has left many states, including Florida, scrambling to find sufficient state money to keep the program afloat until Congress reauthorizes the funding. Later in the show, I'll be talking to U.S. Representative Ted Deutch about what Congress is doing right now regarding CHIP. But first, I want to focus on what the program actually does and why it's important to Broward families with our guests, Rebecca Miele, Florida KidCare Outreach Manager with the Florida Department of Health in Broward County, and Angel Pashall, a parent whose children are insured through the KidCare program. Welcome, ladies.
Thank you for having us. Thank you.
It's such a pleasure to see you again. Rebecca, we have sung this song many times, but for those in our audience who don't know what KidCare is, can you please explain the program?
Sure. The Children's Health Insurance Program is a partnership between the federal government and the state of Florida to help insure children that their parents don't have access to health insurance, or they don't qualify for Medicaid, or their families is just too expensive through their work to be able to afford the health insurance. With the high cost of insurance today, you know how that is. So it's a partnership between the federal government and the state program that allows these families to get an affordable health insurance to cover the health care for their children.
And they are paying for this, right?
They are paying for it.
Although some are subsidized.
Some are subsidized. Most families pay $15 or $20 per month. It is on a sliding scale, depending on the household size and family income. A family of 4 can generally make around $50,000 a year and still qualify for a $15 or $20 premium payment. As the household size goes up, so does the income allotment. So as a family of 5, it's a little bit more. A family of 6, it's more, and so on and so forth.
And there is a full pay option, which is not subsidized, but is still less expensive, correct?
That's correct. It's not really part of the KidCare program, but a few years ago, the Healthy Kids Corporation, which is the third-party administrator for the KidCare program, went to the legislature and asked them if they could allow the children, the families, to go on the insurance, and the families pay the same amount that the state pays the providers. This way, the state doesn't lose any money, but it still gives the families an affordable health insurance compared to what the insurance rates are today.
Now, I'm sure there are people out there, and I don't mean this to be a trick question, I'm pretty sure you know the answer to this, that would say, but we have the Affordable Care Act. Why would children need a special program? Why is this CHIP, also known for those who pay attention to these things, you may see isCHIP, which is the state children's health insurance program, but it's the same thing. Why do we need CHIP if we have the Affordable Care Act?
Well, actually, Cindy, CHIP has been around a lot longer than the Affordable Care Act. CHIP has been around since 1997, so it was here first. And then when they created the Affordable Care Act, they actually formed it around the Children's Health Insurance Program. So, and what do I mean by that was when a family goes to the Affordable Care Act for coverage, the system looks at the whole family. If the children qualify for Medicaid or CHIP, then the children are actually sent to Medicaid or CHIP through the Affordable Care Act. So the Affordable Care Act actually brought in the CHIP program to help cover the children.
So if CHIP goes away, it's not like they can just buy this affordable care through the ACA.
That's correct.
And I believe, although I don't want you to get into this, that that's part of what's going on in Congress right now is this interplay between what they want, changes they want to make to the ACA and KidCare, but we just want them to reauthorize KidCare.
We just want them to reauthorize KidCare.
Now, Angel, you are a mom.
Absolutely.
And you have how many children?
I have 2 children.
2 children, 2 athletic young men, I believe?
Yes, ma'am.
And you have had KidCare how long?
Well, my oldest is now 19, so I've had it the whole time that he's since he's been born. My youngest one is 14, so he's also utilizing Florida KidCare. Yes, ma'am.
And now I know your 19-year-old has now aged out, lest
Yes.
anybody fear that we're keeping kids on forever.
Right.
He has now reached some age of majority, I guess, and so he's now on his own through school.
Right.
But why has it been important to you as a mom?
Well, as a mom, it's definitely been important because otherwise, with 2 children and being a single entity at the time, the insurance that I was using through my work, I wasn't able to afford to carry both of my children on it. So with Florida KidCare, I was able to pay that premium that Ms. Ely is speaking of, and still be able to provide insurance for myself, and then also be able to take them to the doctor respectfully.
And now you said they've been pretty healthy throughout, but they are boys.
Yes.
So what's happened?
Well, one, of course, had broken his collarbone at one point, and then one with a broken leg. And so thank God to Florida KidCare that I was able to, they had insurance and were covered. And so because of that, I was able to afford, them going to the doctor.
You bring an interesting perspective to this. You're here today because you're a parent,
Right.
but also in your professional life, you've seen what can happen when something like a broken leg or a serious illness can really affect a family. Can you talk a little bit about that?
Well, I think, as you stated, insurance is very important, and if you don't have it, I've been able to see those things throughout the community where families were not able to afford insurance, but because I knew about Florida KidCare, I was also able to give that information to families throughout the community and let them know that those things that insurance was available to them, and all they had to do was either go online. If they weren't as computer savvy, they could go, there were places that they could go and apply. So it was beneficial for me as well to know how to let families throughout the community know how to apply for the insurance.
Because one serious illness of a child can send a family into financial ruin.
Right.
And we don't want to see that. When it comes to outreach, you have a great partner there in Miss Rebecca.
We've been doing it a long time, thanks to the Children's Services Council.
Absolutely.
So, Rebecca, there have been some changes. I mean, God willing, CHIP will stay in place, although we all have to stay vigilant. We have to make sure that our legislators understand, and this is not a state legislative problem right now, this is a federal legislative problem. So we have to make sure that our senators and our congresspeople know that this is vitally important. But meanwhile, at the state level, before this whole reauthorization craziness happened, there have been some changes to the CHIP program. Can you talk a little bit about that?
Yes, there has. July of last year, they did, they lifted the 5-year wait for legal immigrant children, whereas they had to wait for 5 years before they were eligible for the subsidized premium. They did lift the 5-year wait, and as long as the children are here residing in the state of Florida legally, they are now allowed to apply, and they will now be eligible, as long as their family still fits within the other guidelines of the KidCare program. And it's been a great help that they've done that too. We've helped to enroll over 400 children just within the last year that would not have had health insurance before. So it was a great thing that they did that.
I think it's really important for our listeners or viewers to understand that we had, prior to 1997, quite a huge uninsured child population, and that has been driven down dramatically. Where do we stand now?
That's correct. Less than 10 years ago, we had, just here in Broward County, less than 10 years ago, we had just under about 48,000 uninsured children here in Broward County. And now, today, we have about 27,000 uninsured children. Now, that's a big drop, but it's still 20,000 uninsured children. We still are seeking out the parents of these children and getting these children enrolled. We're trying some new things this year to reach out to the parents and get these children enrolled, but one visit to the hospital, just one emergency visit, can bankrupt a family. So we're working very diligently to help these families get on to the insurance program.
Well, it really shows how the benefit of the outreach work that you've been doing, because while that's a 28,000 roughly drop, keep in mind that our population has been growing.
Yes.
So in raw numbers, it's down that far. As a percentage of the population, it's gotten even smaller. So what should parents do if they're interested, while they can get signed up? What would you like them to do?
They can call us at the health department. We'll be very happy to guide them through the process. Or they can go online and do the application directly. The issue with that is the online application gets a little complicated. So, and if you put the wrong answer in, then it can reject the application. So we really do like for them to give us a call. We can guide them through the application process and make sure that they are getting all the correct information and answering the questions correctly.
And what's that number?
The
in
number
Broward?
is, we have the Broward County hotline for Florida KidCare. It's 954-467-8737. I'm going to tell you that one more time. It's 954-467-8737.
That's great. And you'll get someone, we have multiple languages spoken on that line?
Our staff are bilingual. We have English, Spanish, and Creole, and we have a language line. So any language that we need, we have access to.
Wonderful. So I think I want our viewers to really recognize the importance of this program and that their voices need to be heard. And so we are going to hear from Representative Ted Deutch, who I had the pleasure of speaking with yesterday, and we're going to hear from him about where things stand in Congress and how you can get involved. Hello, Congressman. Thank you so much for joining me today.
It's my pleasure. Thank you, Cindy.
So we're going to talk today about the Children's Health Insurance Program, nationally known as CHIP, and in Florida known as KidCare. That obviously passed Congress before you were a sitting member, but I know you as a child advocate have been quite a champion for this program. Can you explain to our viewers why?
Sure. Well, at the most fundamental level, we all have an obligation to look out for people who can't look out for themselves. And the work that you do and that I try to do on behalf of kids is, and I think should be front and center there. We have to work to make sure that kids have a great opportunity to succeed, and that starts with making sure that they're healthy. So that's why I do it, but it's been so successful. In 1997, the uninsured rate for kids was over 14%. Today, because of CHIP, because of KidCare, the uninsured rate is now under 5%.
Wow.
And that's a huge step forward, and it means that kids are getting access to care, they're getting the treatments that they need, they're not sick as long, and they can then have a better opportunity to succeed in school and without having to worry about getting others sick and without having to stay home in bed feeling sick.
We know that healthcare is a big challenge for families. I mean, one serious illness for a child or a parent when they're uninsured can economically decimate a family. So access to insurance is vital.
Sure, access to healthcare is really of paramount importance because, as you point out, if it does two things. One, it gives people access to care so that they can prevent illness from hitting them. We can have more preventive care and a better chance to catch something early, because if we don't, and this is the flip side of that, if we don't and they contract an illness and they're sick, they're going to wind up getting care. Often in the emergency room, it's really expensive, and financially it could be devastating to their family.
And there's some crazy thing out there that people think, well, if I'm young and I'm healthy, I don't need insurance. But we both know, I mean, at least I've experienced personally, that you don't know when that next illness is going to come. And
Sure.
my child, my 11-year-old, suffered from ear infections chronically as a little one, and we were in the doctor all the time.
Sure, and people have this mistaken belief that if they're feeling great, that they're always going to feel great, and people get sick sometimes, and it's really important that they be able to get the care that they need if they do. That's why this program is so important, and that's why it's enjoyed such overwhelming bipartisan support really since it was created.
So how did we get here? Now we have a situation where CHIP has been set up that it needs to be reauthorized on a regular basis, which I'm not really sure why that is, but so it is, and it's expired. How come?
Well, there's not a good answer to that. The reauthorization didn't get done in time. What those of us who kicked and screamed and went to the House floor to complain about this were told is that there's money in the pipeline, and so the states will they'll still get they'll still get federal funding, and they'll be able to continue the program. Well, now that argument is no longer valid because states are starting to run out of money. That's going to imperil the ability to provide access to this really important insurance. There's also the fact that there's been an ongoing debate in Washington about the Affordable Care Act, and while I strongly support it and welcome the opportunity to defend it, the fact is there are people who feel otherwise, but that shouldn't interfere with the reauthorization of CHIP, which, as I said before, has historically been one of the most successful bipartisan things that Washington does. We need to let CHIP, we need to reauthorize CHIP, take care of the kids. That's got to be the big focus. And what's more important than being able to look at your family and feel good knowing that we're taking care of them? In this case, we have to do a better job taking care of our kids.
There's so much confusion out there, so much information about healthcare, about the Affordable Care Act, but in this instance, the Affordable Care Act, I believe, was built around CHIP. So they can reauthorize CHIP without touching the ACA one way or another, right?
Sure, and unfortunately, when the CHIP reauthorization came up in Congress, the ACA debate then became a part of it, and so instead of just reauthorizing CHIP and doing right by our kids, there were cuts as part of the overall discussion. There were some cuts to programs that help people deal with chronic illnesses like diabetes and heart disease. There were cuts to some suicide prevention programs. There's no reason for us to let any of that interfere with the reauthorization of CHIP. There's no reason that we should let any debates about anything else stand in the way of moving forward with a bipartisan program that takes care of the children in our community the way that it has since its inception.
And I've never heard anybody say that CHIP itself is adding to the national debt, the deficit. This is not a very expensive program, relatively speaking, for Congress.
Right, and that's what's been so frustrating is when you talk to any of my colleagues, Democrats or Republicans, the same thing in the Senate, overwhelmingly they acknowledge that this is a really important program, that it's a program that has to get reauthorized, that it has done so much to help the kids in our communities, and yet here we are, and we still have not reauthorized it. My hope is that when we go back after Thanksgiving, that there will be a chance, even in the midst of all of the other debates, that we move forward on this. There'll be plenty of opportunities to talk about tax reform, for example.
Sure.
This is not the time to do that, but it's absolutely the time to point out that whatever your views on the tax bill, if everyone agrees that we ought to reauthorize CHIP because it's good for kids and our communities, then that ought to be at the top of our list of priorities. It shouldn't be something that we'll get to if we have time.
It's especially dangerous for our children because, at least in the state of Florida, we're going to run out of money in January, I believe is the prediction. So
Right.
This needs to get done, and our citizens need to stand up and be heard. So the posture right now as we sit here around Thanksgiving time is
It's passed the House. I don't believe anything has happened in the Senate. Is that correct?
Well, what's really important now is that that your viewers and child advocates and people who just care about kids engage and reach out. There are 27,000 children in Broward County who rely on KidCare, which is CHIP. And I encourage everyone to reach out to their members of Congress and their senators with a really simple message, which is reauthorize CHIP without any partisan debates, without any baggage. Just take a program that's worked, that's been successful, and that's enjoyed bipartisan support, and let's ensure that it can continue in that same way.
Of course, those Broward statistics keep me up at night, but I also worry nationally about the 9 million children that are at risk of losing their health insurance. I'm sure you share that concern.
Well, I work with 434 other members of the United States House. Every one of them has a constituency, and every one of their districts has lots of kids that they come to Washington to fight for. And we don't always agree on lots of issues and the right approach on lots of different issues, but this is one where there has historically been agreement, and that needs to continue.
And that seems the very simple message that we need to get out there for everyone in Broward County, in the state of Florida and beyond who get to see this show, is call your member of Congress, let them know CHIP is a simple program for our children. Let's not confuse the debate with anything else. Just get it done.
Yeah, and calls are important. And
yes, what's the best
members
way?
of the House and senators log all of the calls that come in. We keep track, and it's really important. But in this day and age, social media is plays a huge role in political debates. So simple tweets and Instagram posts and Facebook posts telling people reminding people the importance of reauthorizing CHIP. I think that goes a long way, and if they happen, not that I'm running any sort of social media campaign here, but if there happens to be a picture of someone that makes this personal for them, or there's a personal story that they want to share when they make that post, it just helps to drive home the fact that this is something that affects everyone in a really personal way, and there's no time to waste.
That's really good to know, because I grew up in the old-fashioned telephone, fax, email. Yeah. So social media, hit your congresspeople, senators with the social media.
Absolutely.
Excellent. Thank you so much.
My pleasure. Thanks for giving me the opportunity. It's good to be with you.
I really appreciated that opportunity to sit down with Representative Deutch and get his perspective on this issue. As parents and caregivers, our main concern is the well-being of our children. Making sure that they have affordable and accessible health care coverage should be important to all of us. We ask you all to make it clear to Congress that you want to see CHIP reauthorized with no strings attached. I want to thank Rebecca Miele, Angel Pashall, and Congressman Ted Deutch for this important conversation. I've been your host, Cindy Arenberg Seltzer. For this or any other episode of Future First, Focus on Broward's Children, go to our website, www.cscbroward.org, where you can access our YouTube channel, like us on Facebook, and remember to join us next time on Future First, Focus on Broward's Children.